After a traumatic physical injury, pain is normal. Living with it, managing it, and controlling it, that's what today is all about. You are entering a phase of recovery that requires careful attention. We understand that only you know what your pain feels like.
The morning after my accident, when I woke up, I was in horrible pain. Everywhere from my arms, to my hands, to my legs, and even in my ribs.
It persisted and it never went away, and it just kept getting worse.
It was pretty bad after every surgery. It would hurt more when I had to move. I was pretty sure that what I was feeling was the worst pain I've ever felt in my entire life.
The goal of pain management is to help you determine what level of pain you can tolerate. And our goal is to help you function at that level. It is important that you understand that it is going to hurt as you go through physical therapy, even as you move around your own room, when you go to the bathroom. All of these functions can be uncomfortable. This process will probably take more time than you would like, but setting goals and following a plan will allow you to function again.
It's scary when you're going from the hospital over to rehab, because you know that there's going to be a difference in medication, because that was the plan made with the doctor, and that you know there's going to be pain. And I eventually just had to make a really big effort to just get used to feeling some discomfort, some pain, because I knew it was all worth it in the end, because it would mean I could move forward in my recovery, and that's one step closer to being home.
I didn't allow it to control my therapy or whatever I had to do. So I really didn't concentrate on the pain that much, even though it was there.
Pain is measured on a scale from 0, which is no pain, to 10, which is the worst pain you've ever experienced. Your goal and ours is to reduce your pain and to enable you to do the things that you want to do for yourself again. Most people have an acceptable pain level of 5 or 6. An acceptable pain level means, well, you still have pain, but you're able to reach your day's goals, such as getting needed rest, participating in your therapy, getting up to sit, to walk around the room.
I'm never pain-free, so I had to know the numbers where when is the worst time and when is the level where it's manageable.
You know, a 10 was couldn't focus, didn't want to open my eyes, and then maybe like a 9 was, you know, I'm just like shaking with pain, but I can hold on a somewhat fragmented conversation.
As you consider your treatment plan, medication, physical therapy, musical therapy, these are all ways to help you manage your pain.
When I went to rehab, there were a lot of strengthening exercises, mobility techniques.
Aquatherapy was so helpful for me. It was really like it took my pain away. It really helped with the pain.
The strides I was making with my rehabilitation motivated me to push through that pain more, and kind of push the pain off to the side is not a major concern. The major concern is getting home and getting rehabilitated.
Medications like narcotics, pain control patches, muscle relaxers, and even Tylenol or ibuprofen may be part of your treatment plan. These medications will be used carefully and in a limited manner. At first, it may seem a little scary to reduce or stop using some of your medications, but remember, your goal is to learn how to function while managing your pain at an acceptable level.
One of the things you don't really realize is how difficult it is to manage pain and the amount of effort it takes with medication, either going on a new one, going to a different one, or tapering down.
Basically, you can't just take a pill because you're hurting. That's bottom line. You're gonna come to a point where that amount of medication you're taking is not gonna work. So you have to be careful, because you're eventually gonna get addicted to it.
With some injuries, the pain will eventually go away. With other types of injury, however, the pain may be ongoing or chronic. This will require that you adopt a new approach to life, one where you accept that pain is going to be part of how you live, but with the various treatments that we're going to be teaching you, you can have a productive and meaningful life.
The pain is there, I get used to it. It's part of my life now. I just don't allow it to consume my thinking.
And I think the ultimate motivation for weaning down on medications is getting back to a normal life.
Only you know what your pain feels like. Our goal is to work with you to manage your pain and to help you through the recovery process.
Having an injury as severe as this one, you can either let it ruin your thought process, or you can just leave it behind and move on and look forward.
When you're in the hospital after a major accident, you feel like you're never going to leave the hospital. But now, 6 years later, I wish I could go back and tell myself that it's going to be okay, because there's so much more I can do now that I didn't think I could do then.
We look forward to helping you through your recovery. If you have questions regarding your acceptable pain level, your pain management therapies, or if you would like to talk to a trauma survivor, please ask your doctor. Remember, we are here to support you.